So Parkinson's disease is a progressive neurological disorder which is characterized by the degeneration of certain nerve cell in the brain. So probably which is related with the producing dopamine. So dopamine is a neurotransmitter, so for movement, which is important for movement control. So while there is currently no cure for Parkinson's, various treatments can help manage its symptoms and improve the quality of life with individuals living with Parkinson's. Although the Parkinson's disease cannot be reversed, so some treatments can help in slow down the progression of the disease. So the certain treatments are it includes medications, medicines like dopamine agonist, Syndopa, MAOB inhibitors, and anticholinergic drugs, which elevate the symptoms and to reduce the motor symptoms of the patient, like bradykinesia, rigidity, and tremors. So the second important treatment is deep brain stimulation. So it involves implanting the electrodes into the specific parts of brain and connecting them to a device. So similar to a pacemaker. So it helps in regulation of the abnormal activity of the brain and alleviate the motor symptoms of the Parkinson's disease. So instead of deep brain stimulation, we can do listening surgery, so which also helps the patient to alleviate the symptoms like motor symptoms such as rigidity, which I said earlier, rigidity, tremors, and bradykinesia, which is slowness of the movement. So third one is physical therapy. So it includes encouraging the patient in physical activity, like encouraging them to do exercises, so which improves the mobility and the flexibility of the muscle. Balance retraining, so it helps the patient to reduce the risk of falls, and functional re-education, which will help the functional ability of the patients. Third one is occupational therapy. So it focuses on strategies to improve the daily activities and independence, so which are affected by the Parkinson's disease. And the next one is speech therapy. It focuses on improving the clarity in speech, swallowing function, and also the communication skills which are affected by the Parkinson's patients. And the next one is lifestyle modifications. So encouraging the patients living with Parkinson's to do the daily exercises, maintaining a proper diet and healthy diet, and managing their stress, and asking them to take adequate rest will definitely help the patients in the day-to-day life. So although the above mentioned treatment strategies provide significant relief, it is important to note that the progression of the disease varies from person to person. So some may experience a rapid decline in the progression, some may experience slow progression of the disease over many years. So the take home message is early diagnosis and comprehensive management by proper healthcare professionals will give a good outcome measure. And also in addition to that, ongoing researches about the underlying mechanism of disease and new treatment strategies offers hope for the future. Thank you.